Did you know that NCLEX is changing? Yes, I have been talking about this for weeks now. The NCLEX exam is being redone and you need to pass now or be ready for these changes So the first thing that I want to talk about is what is going to be the reason the NCLEX is changing and how will those changes be presented. And so the next generation NCLEX, the reason why it was developed to make the exam more real. So to strengthen the linkage between the test items and clinical judgment. And this is going to be using a clinical judgment model. Now, I want to show you this clinical judgment model because I bet you have never seen it before in nursing school. We have many ways to measure clinical judgment, but this is new. This is actually the National Council State Board of Nursing Clinical Judgment Measurement Model. Take a look at it in all its glory. I can honestly say this is one of the most complex, in presentation, one of the most complex clinical judgment models that I've seen. And, I have to accept it. And you guys who are taking next generation, those of you who have to take it, and then those of you who will put off taking NCLEX, put it off, and you will end up taking this, you're going to have to be able to appreciate this. Now, let me just give you some structural layout of this clinical judgment measurement model. There is actually 4 layers. And so if you look at layer 0, it is a very broad layer. You don't get a lot of information on it. It's basically, okay, what are the client's needs? And then how do I get to the decision of it using some sort of clinical judgment? And then as you go up a layer or down, I guess the way we look at it, you're going to get more specific information into the clinical situation that you will be presented. So for example, when we're looking at the clinical judgment measurement model, let's look at layer 3. This is a very important layer because it is going to outline all of the steps that are going to be directly measured, right? So recognizing cues, analyzing cues. These are things that you are going to do that will be part of your clinical judgment demonstration. These are things that you're going to do that will determine that you are a safe and competent nurse. And so these different layers, even moving down to layer 4, which is an additional layer, and it just adds more context, more environmental factors, more individual factors that are going to directly affect the presentation of the cues. So these layers are going to make the NCLEX questions better and more realistic. So get comfortable with this measurement model. And I want to point out, though, that even with the layers and the different action items, the nursing process still is a part of this clinical judgment measurement model. And it's like the foundation of it. We still see that this is a very familiar measurement model because it incorporates these assessment, analysis, planning, implementation, and evaluation. So again, if we are looking at the different layers, layer 3, this is considered the action layer of the CJMM, clinical judgment measurement model. And then layer 4 is where the questions, like they say, the questions can get dirty. So this is where you can make them more realistic, right? And so with layer 3, the action layers, you are going to have to do these things. And these are the actionable items. Okay. If you didn't see it in the CJMM, you're going to have to recognize cues. You're going to have to analyze cues, right? These are action words. You're going to have to prioritize hypotheses. You're going to have to generate solutions. You will have to take actions. And then you're also going to have to evaluate outcomes. So yes, layer 3, a lot about what you are going to be doing. Layer 4, the dirty layer, is how we're going to be making our questions better. These are going to be, again, as an overview, adding environmental factors and individual factors. And so listen, again, if you're preparing for the next generation NCLEX, I'm going to explain it. I'm going to break it down to you so that you feel comfortable. We're going to be working on that more into next year. But if you don't have to take it, right? If you don't have to take it, then don't take it. All right. But the questions are definitely going to be more realistic. So as I introduce the next generation NCLEX to you, I'm going to present just a sample question type, and we're going to get more into this, the different question types and the different presentations, but I want you to be exposed to what the exam will feel like. And so again, I see a lot of people asking me, Regina, when is this going down? When is the next generation coming? The next generation is coming April 2023. So here is one of my favorite new presentation types, and this is the highlighting item. And so I'm going to ask you guys to prioritize 3 items that require follow-up by the nurse. And I'm going to give you the question here. And again, you're looking for 3 items that are going to require follow-up by the nurse. So here's our case study. EK is a 39-year-old male. Let me see here. There we go. EK is a 39-year-old male with a diagnosis of erythrocytosis. Hemoglobin hematocrit has trended down from 15.9 to 47.2% to 12.4, 37%, with carboxyhemoglobin of 8.8 still elevated. He continues with therapeutic phlebotomy every 4 weeks and takes aspirin 81 milligrams daily. The client is a current smoker, started smoking in 2002, trying to quit but is having a hard time complying. His latest chest X-ray revealed no acute cardiopulmonary abnormality. The client admits that he is a snorer and was told he possibly has obstructive sleep apnea. The client reports low energy levels. Ferritin is 25. The client denies hematuria and melena. Vital signs are temperature 98.3 Fahrenheit, pulse 80 beats per minute, respiration 18, blood pressure 124/82, and oxygenation stat at 97%. So if we are reading this client presentation, I'm asking you guys to prioritize 3 items that require follow-up by the nurse. 3 items that require follow-up by the nurse. So this is going to ask you to definitely, let's look at analyzing some of the things that we have in front of us. Okay. All right. Let's start with the first one. I don't know if you guys saw this, but number 1 thing is this carboxyhemoglobin of 8.8 still being elevated. This is a concern for me. Carboxyhemoglobin is telling me that our patient has some exposure to carbon monoxide. What is going on with this patient? I see that they have erythrocytosis, but what is the cause of this elevation? Did you identify this? All right. This is what you're going to have to do for next generation NCLEX. The second thing is that the client is a current smoker. He started smoking in the year 2002. He's trying to quit, but is having a hard time complying. So that's all one statement. That concerns me because I know that smoking can affect the oxygen capacity of your red blood cells. It can affect your oxygenation. So if a patient stops smoking, the erythrocytosis will be better. Okay. Another thing that concerns me, the third thing is this. The client admits he is a snorer and was told he possibly has obstructive sleep apnea. So how about this? We need to get a follow-up to make a determination of what is going on with this patient, because sleep apnea also affects your oxygenation status. So this is an example of a highlighting item. You need to be able to identify things that are concerning. You need to be able to make hypothesis and with the highlighting scoring rules, just quickly, not to go too much into this, but you have a plus minus scoring rule here. So for next generation NCLEX, the items are scored differently depending on what they are. And so with the plus minus scoring rules, points are earned by identifying and selecting correct options. So that is great. If you can select a correct answer, you're going to get a point for it. However, with the plus minus, in contrast or on the opposite side, if you get something wrong, it is going to be subtracted from the things that you did get correctly. So because we have partial credit, if you only identified 2 of these correctly and the third one that you identified was actually not correct, that is going to take away from one of your 2 correct points. So you would only end up getting a 1 on this particular question. So it is going to definitely be a lot to think about when it comes to the next generation NCLEX. So if you have the potential to take and pass NCLEX now, let's do it. But if not, we will continue to prepare for next generation NCLEX. However, I am doing my due diligence. I am encouraging you as your NCLEX instructor. Right now is the best time and opportunity to take the NCLEX exam and get your nursing license. There is not a better time coming. I'm telling you guys, do not waste an opportunity to test now. All right. So if you're able to test now this year, do it. And then let me show you how to do it. Let me show you how to do it and passing your board in the next 4 to 6 weeks or less with my NCLEX virtual trainer straight for you. So if you are ready to get your nursing license, this is the opportunity. Guys, don't forget, you can, you will, you must pass NCLEX, because with God, it's possible.
Hey ReMar nurses, my name is Latasha Gibson and I would like to share my experience using the virtual trainer and the Quick Facts for NCLEX book. I used the virtual trainer for 6 weeks. There was a schedule provided with it. I stayed on the schedule the whole 6 weeks. I also used the Quick Facts book. I took that book everywhere with me and I memorized the whole book before I actually took my NCLEX exam. Shortly after the virtual trainer program ended, I registered to take my NCLEX and I passed on my first time in 75 questions. I did have a lot of select all that apply, which can range from one answer choice to all. I currently work in a step-down ICU unit, and with prayers and a lot of studying, you can, you will, and you must pass NCLEX. Good luck.
The NCLEX Virtual Trainer is the best training system for nursing students who need to pass the exam. My name is Regina, MSN RN, and I have helped thousands of nursing students pass the NCLEX exam with my program. You're gonna love it. With my NCLEX review, I'm going to give you all of my nursing content in one place. Not only that, I'm going to make sure that after every individual lesson, you know what is most important. And if you need questions to help you, I have the questions right here. So what I'm gonna do is I'm gonna give you an amazing opportunity to get in the virtual trainer. I'm also gonna send you the virtual trainer student workbook, as well as my quick facts for NCLEX. This is it. This is the opportunity that you've been waiting for. Click the link below. This is the #1 training system for nursing students who need to pass NCLEX. Don't miss out on this opportunity. Click the link below. Hey, what are you waiting for? I want to see you on the inside. This is the opportunity. You don't want to miss it. If your nursing license is important to you, you will take action right now. Let's click the link. Let's go.